What is hydrocephalus? Hydrocephalus is commonly known as water in the brain. This means there is a buildup of fluid in the cavities deep within the brain. Hydrocephalus is a normal medical condition that develops when the normal flow and absorption of cerebrospinal fluid, also known as CSF, in the brain is hindered or blocked, resulting in excessive accumulation in fluid of the brain. This can exist at birth or be acquired over a period of time. The National Institute of Neurological Disorders and Stroke, NINDS, estimates that 1 to 2 of every 1,000 babies are born with this condition. Left untreated, in addition to pain and suffering, this leads to significant brain damage, severe developmental delay, blindness, and ultimately death. Okay, types. There are 2 types of hydrocephalus: congenital, which develops before birth, and acquired, which develops after birth. Congenital hydrocephalus develops before birth, as I previously mentioned, and genetic factors can influence the development. It also can occur along with other conditions associated with the brain as well as the spinal cord. As for acquired hydrocephalus, this can be developed after a brain hemorrhage, a traumatic brain injury, tumors, cysts, or infections. Premature babies are at greater risk for brain hemorrhages, which can lead to acquired hydrocephalus. Symptoms in children: blurred or double vision, delayed development, headaches, nausea, poor coordination or balance, as well as vomiting. Okay, diagnosis and tests. Ultrasonography often allows experts to diagnose this before birth, but if it is not detected before birth, it's usually detected at birth or not long after. It's less frequently detected in older children, teens, or adults, but that doesn't mean it doesn't occur. Continued. Ways to diagnose this: doctors use image technology such as CT scans, MRIs, and as well as ultrasonograph. Okay, treatments. Surgical incision of a shunt. A shunt is a flexible plastic tube about 1/8 inch in diameter with a valve that controls the flow of CSF draining from the ventricles of the brain. Shunts are most often placed in the lateral ventricle, where they can be drained in abdominal, the chest, or the heart. And I actually have a video that explains it a little bit better.
Hello, I'm Peter Nakaji, neurosurgeon at the Barrow Neurological Institute. And it's my pleasure today to tell you about some of the conditions that you may be treated for here. Placement of a ventricular peritoneal shunt for hydrocephalus is one of the most common procedures in neurosurgery. Hydrocephalus is a condition of excess fluid in the brain. In this condition, too much fluid is present, causing a variety of symptoms, which may or may not be under excess pressure. The treatment for this is to place a small tube into the brain, into the fluid spaces called the ventricles. That tube then comes out to a space under the scalp, where it passes down under the skin, down to the belly. There's a valve that's located somewhere up on the head, which controls the flow of the fluid, and can be used to adjust or increase or decrease that flow as needed. The fluid is then taken down to the perineum, not inside the bowel, but the space around the bowel, which is very effective at absorbing fluid. For many patients with this condition, it will lead to an improvement in their gait, their ability to control their urine, and their ability to think or remember things more clearly. Not every patient has the same symptoms, but most patients who pass through the evaluation process will do well with this procedure. There will be an opening on the top of the head, usually with some sort of suture that needs to be removed at the end, and on the belly end, usually with an absorbable suture that does not need to be removed. Most patients are able to stay just overnight in the hospital and go home the next day. An adjustment is often made to the shunt after you leave the hospital to turn the setting down. We don't always start at the lowest possible setting because removing fluid too suddenly in these patients can sometimes cause complications. Therefore, you may not have improved as much right after surgery as you did when you had your spinal tap, but you probably will in the future. Overall, this is a highly successful surgery for patients who qualify for it.
Okay. Oh. There we go. Okay. Okay, resources for school-age children with hydrocephalus. As for school-age children, there is one book that really stood out to me. This was called My Brain Won't Float Away by Annette Perez. I thought this was a very clever title because hydrocephalus is also known as water in the brain, as I mentioned previously. This book is about Annie, who is an 8-year-old girl living with hydrocephalus. Not only is the book very honest and speaks upon Annie's fears and triumphs, it also has humor, which I feel is a great component to be brought into. This book is for ages 6 to 10 years old, and I believe it would be a great resource for school-age children. Although books are an awesome way to learn as a child, I wish there were more resources for younger children dealing with this condition. This is the cover of the book, My Brain Won't Float Away. It's written by Annette Perez, and if you were interested in purchasing it, you could go on Amazon, type in the title as well as the author, and it'll bring you right up to the page. Alright, developmental stage. A school-aged child is dealing with industrial versus inferiority, according to Erickson. This means that they are developing or have developed a sense of confidence in their abilities. According to Piaget, school-aged children are in the concrete operational stage of his cognitive developmental theory. This means children begin to think logically and are no longer egocentric, meaning that they are starting to have feelings for others rather than just themselves. Alright, moving on to issues related to hospitalization. At this age, it is very common to see children who have many questions about their health. They may fear that they will never get better and that they will constantly be in and out of the hospital. They are spending significant time away from school, which alters their cognitive development. At this age, peers play a huge role in development, so not being around their friends or peers can affect their social and emotional development. In order to ease their minds, be sure to explain procedures in terms that they will understand and allow the patient to get involved by making decisions based off choices that you have given them. This makes the child feel that they are part of their healing process and not just another patient. Alright, child-life interaction. An MRI is used to diagnose hydrocephalus, so for a child-life interaction, we'll be prepping the child for an MRI. Because this is a school-aged child, it is very important to get them involved. Make sure you ask if they have any questions and ask them to repeat steps back to you as you're telling them what the process will be. Alright, I have a video to show that I think does an awesome job of showing how to prep a child for an MRI. It keeps it lighthearted and fun. So the video is right here.
Hi there, I'm Jess and I'm having an MRI scan today. I'm having a scan on my head. What are you having? MRI stands for magnetic resonance imaging. It takes really detailed pictures of your insides so our doctors can see what's making you feel unwell. A MRI scanner looks like this. It looks like a big camera. This is Sam. She's a radiographer. That means she's a special MRI expert.
Before we go in, Jess, we need to make sure you don't have any metal objects with you. You can put them in the lockers if you do.
If you have any metal objects on you whilst you're in the scanner, your photos might not come out very clearly. You don't want that to happen because the doctors won't be able to see what's making you feel unwell.
Great. Ready to go?
Yeah. You have to lie on the MRI bed for the scan, and the bed will then move into the scanner. You can pretend it's like you're going into a rocket. When it's time to start the scan, you have to lie very still whilst it takes pictures of you. Otherwise, they'll be all blurry. You'll get some earplugs and headphones too, as the scanner can be very noisy. As I'm having a scan on my head, I to wear a special helmet, just like an astronaut. It will make my pictures extra clear.
Are you ready to blast off then, Jess?
Ready? The radiographer will have to go to the room next door to control the scanner and make sure the scans are coming out clearly. But don't worry, you'll still be able to speak to them and hear them through the microphone and speakers in the room. When you're in the scanner, you can pretend you're going past all the stars and planets.
Okay, Jess, we're going to start taking some pictures now. So you're going to hear some loud noises. Imagine the sounds of rockets flying past you. But remember to stay as still as you can so that your pictures don't come out blurry.
Okay. When the scanner starts taking pictures, you'll hear noises like this.
You're doing really well.
This is what your pictures will look like. And after the scan is over, the radiographer will come and get you out of the scanner.
Okay, so I think that did a really good job showing how to prep a child for an MRI. Next, if you're going to be receiving a shunt, you will have to go under anesthesia and you'll receive an IV. Surgery is a scary idea for individuals at any age, so making sure you prep the patient and their family for what's going to happen is really important. Make sure you ask if they have any questions. It is important for them to address any of the fears they might have. Let the child know that it is okay to cry, be honest, and use terms that are familiar with them. When prepping for an IV, make sure you let the patient know that the needle does not stay in, but only the plastic catheter does. This gets rid of a lot of anxiety. Sometimes it might be helpful to let the child IV a teddy bear as practice. This is known as medical play. It allows the child to get familiar with the procedure, and the anxiety they might feel begins to go away because they practice it on another object. So a quick review. There are two forms of hydrocephalus, which is congenital hydrocephalus, which develops before birth, and acquired hydrocephalus, which develops after birth. There aren't many resources for school-age children besides books, and treatments include insertion of shunts. It is so important to get the patient involved in their treatments, ask questions such as use medical play, let them make decisions. Be familiar with developmental issues related to hospitalization. It's always a good idea to possibly get a tutor involved so children don't fall too behind in their schoolwork, and when they make the transition back into school, it's just easier for them. And then make sure the child and their family are as comfortable as possible and address their questions. Okay, thank you. And for more information, you could Google the Hydrocephalus Association or just go to their website at hydroassoc.org. They provide abundance of information, and you could also donate there.